Welcome to the True Skin Experts Podcast, your trusted source for clear, science-backed information on skin health and beauty. Presented by American Society for Dermatologic Surgery board-certified dermatologists, the episodes break down topics from skincare to medical dermatology and cosmetic procedures, so you can feel confident in your skin health decisions. Whether you're managing a skin condition, exploring cosmetic options, or just curious about the best skincare practices, we're here to empower you with expert advice, one episode at a time. Enjoy this episode recorded live at the 2025 ASDS annual meeting, showcasing the energy and innovation that make the dermatologic surgery community and ASDS members the true skin health and beauty experts.
Hi, I'm Deirdre Hooper. I am the president-elect of the American Society of Dermatologic Surgery, and I'm here for the ASDS True Skin Experts podcast. And I'm here with my dear friend, Drew Fine.
Good to see you.
Drew is the general manager of Obagi, and today we're planning just to talk a little bit about our long journey. We've had a long journey together. We've got kids going through college. We've been through years of seeing the evolution of what's going on with injectables, which is something I do a lot of in my practice. And Drew, of course, is doing a lot of it, bringing this Obagi filler to us. And so today we're going to just start by just talking. You know, Drew, what do you think's going on with fillers today as opposed to 10 years ago?
Yeah, it's good to see everybody, and thanks for having me. It's funny, I was looking through my old pictures because we've known each other for like 10 years. If I do remember correctly, I think I'm actually a patient of yours from back in the day.
I've injected you.
Yep,
You still look good.
I do, thank you. I know some great injectors and some great dermatologists. So we've known each other for a while. I loved all the educational work we've done in the past, a lot of clinical work that you've done for the various companies that I've worked at. So it's been a pleasure kind of getting to know you over the years, and I'm happy to share a little bit with the audience today. So
yeah, that would be great, because I think, you know, those of us that inject a lot, we love fillers. We don't think filler is a bad word. And so that's something that's gone on with patients lately, is that they say, oh, I have filler fatigue or filler fear. And really what I want to talk to you about is, how do you, when you're setting up your fillers and looking for something that you might want us to distribute, what are you looking for in a filler that makes you think this is one that my doctors, the good injectors, are going to be able to get good results with?
So I love the question. I'm going to back up and tell a story, because I think it kind of helps you understand how I think about this. So when I first started in aesthetics in 2014, I'd worked for Eli Lilly for a long time, and I was in diabetes for my whole life. And I got called by this company called Galderma to take a role, and I was going to be leading a brand called Restylane. I'd literally never heard of it. So I called my mom, and I told her I was going for this job, and she goes, oh my gosh, this is so exciting. You got to know this, 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 and this. You got to ask me this, 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 and this. I'm like, I had never heard of it before, but you clearly loved what these products could do.
Yeah.
And she's like, oh yeah, they just, a little bit here, a little bit there, and you just look and feel great about yourselves, and they're going to help people age gracefully, look natural. They're safe, they're effective. If there's problems, you can fix them. And I'm like, I knew nothing about this. But like my mom, a patient, clearly she's an aesthetic patient. She's now in her 70s, and she still looks great and does all the things. But I think that's what really is so important about fillers for patients.
Right.
If you go back to like, just what's the really important need of what you're trying to do? People are aging every day, natural process, our bones shrink, our fat pads, atrophy a little bit, skin gets a little loose. These are all natural aging processes, and a lot of the work great dermatologists do help patients solve a lot of those problems. And a good filler can be part of that solution.
Couldn't agree more. And when I talk to my patients, I talk about the fact that one of the causes of aging is volume loss. And addressing volume loss with injectable fillers is a great tool. If you use injectable fillers to address skin laxity or areas of skin quality that are really not the domain of the filler, then you can end up with some unnatural results. And so I think the thing that I'm hearing from your mother, who must have had a great injector, is that the people who have a positive reaction, it's not really about the way they look, it's what you said, it's the way they feel. Because when you start losing volume in your face, you can look tired, you can look unhealthy, you can look sad when you don't feel that way. And so I think really having a relationship with a true skin expert, someone who can look at you, assess you and say, I do think you have a volume loss problem. I know how to inject you safely, in what plane, with what amount, and how to reassess you, because it is a lifetime journey. So tell me more about the fillers that you're bringing to us, because that's exciting, the Obagi brand.
So I love that. So I actually love what you said, is like, you talk about different patient needs, and a lot of it's about fitting the solution to the need.
Right.
I think sometimes people think about a filler and they're like, oh, I gotta use a filler to fix every problem.
Right.
And that's actually not the right approach. You gotta know what's the problem and then what's the right solution. It could be a filler, it could be skincare, it could be some other modality that you're using. So yeah, so my current job is kind of interesting. Like I said, I used to work for Galderma. I've also worked for Allergan. I've had some startups.
Right.
And one of my startups that I was working with actually just got acquired by the company that owns Obagi. And then they asked me to come on board to kind of be the general manager of that business. And part of the idea was to launch some new hyaluronic acid injectables under the Obagi brand. Obagi is kind of the OG skincare brand in dermatologist's office, been around for 35 years. We've been joking a little bit that now that we have the injectables coming, it's time for a little bit of a glow up, maybe a mommy makeover, so to speak, and kind of take Obagi into its next level. And that's right where all of our patients are.
Right.
And so the idea is not just that we're going to launch a filler, but we're going to have a whole Obagi protocol. You trust Obagi with your skin. And most of your patients, I know when I came to your office, the first thing I did is they took some pictures.
Right.
They did a full assessment.
Yep.
You gave me here's a treatment plan. Here's what we're going to do today. Here's a bunch of other stuff that we could do over time.
Right.
And here's what you need to do to really take care of your skin. And so the idea is, how do you have a company come to market under one brand so it's easy for patients that brings all that to life?
Absolutely.
So yeah, so that's kind of the idea. Fortunately, we just had our first injectable was approved just a couple months ago. So it's called Obagi saypha MagIQ.
Obagi saypha MagIQ.
Yeah, so I like to think that many of the dermatologists that I know have magical hands. So we want to give you a magical product to help your patients.
Well, tell me, so if I've never had filler before, don't really have a concept of what are you filling me with?
Yeah.
Because I know we've been to Sweden together, we've been to the factories and seen how do you make these products safe, long lasting, avoiding complications. Like what's in this filler? What's the product?
Well, so this was the fascinating thing when I first started in the business. They're made out of hyaluronic acid. Hyaluronic acid, it's not an acid, but it's a natural product that's in your body, and it attracts water.
Right.
As you age, you know this better than me, I shouldn't be lecturing here, but as you age, you lose hyaluronic acid.
Right.
So these filler, but the problem is hyaluronic acid has a very short half-life. So if you just injected hyaluronic acid, it would go away very quickly in a day or two. And you correct me if I get into science.
No, you're nailing it. You're nailing it.
So what we do is they go through a special manufacturing process. They cross-link the HA together so it lasts for a longer period of time.
Right.
So now you can inject it as a gel. It attracts water, and it replaces volume that you've lost as you age. So the most common areas that you usually get your first approval for are your nasolabial folds.
Okay.
This kind of fold that happens, the smile lines, the accordion lines, whatever you want to call them, the parentheses. People hate those as they get older.
Yep.
It's natural, but you can put a little bit of filler in there, softly efface them, and you look a little bit younger, you look a little bit happier, maybe a little bit more confident, and that's what they're used for. So that's the first one, and then there's other ones coming. For cheeks, there's other products approved there. We have one under FDA review for that. And then there's other areas that you get approval for in the US as well. But they're just made out of a natural sugar that's in your body that you do a special manufacturing process to make it last for a longer period of time.
Yeah. And you're keeping it sterile. And so I always tell my patients that hyaluronic acid, we all have it. The average human has 7 kilos of hyaluronic acid in their body. Yeah, I'll give you a little basic science, but it's in your connective tissue. It's part of what is keeping you bouncy and resilient. Yeah. And so as it declines, adding some that your body is already familiar with is the reason that these things came about, because the manufacturers, to their credit, were looking for something that could be injected safely that is not going to be foreign to the body. So
and there's hyaluronic acid in a lot of the topical skincare products because it attracts water, keeps your skin glowy, bouncy, hydrated.
That's why when our patients hear it and they say, well, I'm using it on my face, and I say the reason is it's drawing water. Yeah. So when we inject it in the right plane and in the right place, and what you said was very important, I want to touch on that, is it is really up to the person with the needle in their hand to determine where they're putting that product. Yep. And I know, one of the sentiments we were talking about is, why are people afraid? And they're afraid because, frankly, they've seen some weird things. They've seen some weird outcomes. And if you watch a face age and you're an expert in assessment, you can look at that face and you may notice that they've lost volume in all sorts of different areas of their faces. And so you're talking about approvals and on label and what the companies do their studies on, which is very expensive and very important. But then I would like to just point out that then you get it into our hands, and that's where when you're a patient and you're talking to a true skin expert, two things they should know. Lots of different areas and planes can be injected with lots of different...
The anatomy is so important. We actually do a lot of training on anatomy for other people as well.
Yeah, I think that's, so really when you're talking to someone who's going to inject you, you want to make sure that they have an understanding of comprehensive volume loss in the whole face, and also, as you hit on, comprehensive skincare, because it's not just volume loss. And that's where Obagi is so great, because you've built products. There was Obagi Tretinoin and hydroquinone, great moisturizers.
We still got them.
We
got some cool new stuff too on the Obagi line that many people haven't heard of. So,
well, tell us about that.
So we actually have our most popular product right now is a brand new scalp serum.
Oh, really?
Under the NuSil brand. So many people know our NuSil Lash and Brow line, which are very popular. They're great products. We have a new NuSil scalp serum.
Okay.
Scalp health is really important. As a lot of the GLP-1s, you're seeing a lot more hair loss, a lot of things going on in the environment. So scalp's kind of having a moment. So we like to say your scalp is your skin too. So the people who know how to take care of your skin are now helping you take care of your scalp. We still got our Nuderm system. Many people love it with hydroquinone. We've got great tretinoins. And then we have a whole host of other kind of anti-aging, vitamin C's, and other products that go with it. A really comprehensive line many practices carry.
And I remember when I was starting my practice and learning that Nuderm system, and I sort of can look at any one product and say, oh, that's a great antioxidant, that's a great exfoliant, that's a great skin lightener, a skin smoother. But what the beauty of what Obagi does is they do streamline it, because it's overwhelming. And if you don't have the guidance of a true skin expert, then you might be using 2 or 3 of the same product. So I love that that having that whole line. I think that's awesome. So important, and that you'll keep doing that.
Yeah. The other interesting thing you mentioned, just back to the kind of filler conversation, it's interesting when you talk about having a true skin expert, which I love that. And I love a lot of the dermatologists that we know. The other thing is it really speaks to the importance of safety. So that's the other thing I think a lot of patients should know about hyaluronic acid. And this is part of the reason they became so popular. Hyaluronic acid injectables have been out for over 20 years. The patient need is around, I want a safe product. I want something that's going to effectively meet my needs, and I want a trusted person to help me provide it. And so that's what those products have done for a long time.
Yeah, I love that you're saying that, because at ASDS, that's our biggest focus is safety of our patients. And I think when you're a patient and you're trying to decide, should I have this person inject me? Should I be injected? Having those conversations with your injector should be quite easy to have. And your injector should be very comfortable saying, I know exactly how to reverse this. And as you mentioned, a lot of people don't realize this. These fillers, I injected my first HA filler in 2003.
Isn't that crazy? 2003.
My son is 22. It was a long time ago. And
I can't believe they're getting that old.
I can't believe they're getting that old. But I'll tell you what, I've been injecting these fillers for so long, and for a long time it was a little niche. Not so many people injected fillers. And then as time has gone on and the adoption has increased, what's been great about that is more and more people have access to injections. But sometimes the flip side of that is maybe someone isn't quite as trained or doesn't know how to handle the complications. So that's just an important conversation to have.
It's really interesting. I was just looking at some data the other day. So there are millions and millions of patients who get treated with a hyaluronic acid injectable every year. And I know there's a lot of buzz, and this is why we're talking about fillers. I was looking at some data on what happens most commonly in aesthetic practices. Dermatologists who do aesthetic or cosmetic, med spas even, or plastic surgery practices. So the number one thing that happens is a neurotoxin treatment, which you'd expect. Even today, even with all the noise on fillers, the number 2 thing that happens is hyaluronic acid injectables. So it's still the second most common thing happening in most practices. So it's happening every day. There's great injectors getting great results with patients. Social media has gone a little bit crazy. I've got a 15-year-old too, and I have to watch exactly what she's doing, among other things. But I think, you said before, like sometimes people look weird, and that's what people notice. What they don't notice is the 99% of people who just look natural and normal. Like I know I've had plenty of hyaluronic acid injectables. Hopefully I don't look too crazy on the camera. And I think we know tons of people who look great and natural and normal and refreshed and maybe a little younger than their age. And that'll always be part of what I do. It's not the only thing I do, but it's certainly part of my plan. I do, fortunately I work for Obagi, so I've got some great skincare. I love our Rebalance product. Actually, I use this aftershave, which is a secret that you can use when you work for the company. I'll do neurotoxins. I'll get the occasional laser treatment every year or 2 as well. I'll do some various facials. So I kind of live in the world, so I understand what the patient journey is like. And if you do that, you're not going to look crazy if you go to the right people.
Exactly. And we've got 1,200 people at this ASDS meeting, and I haven't heard one person say goodbye to hyaluronic acid fillers. We all love them. We all partake. I would love, just before we finish, just to talk a little bit more about GLPs and hair, because I do think these are hot and increasing topic. And once again, it's all part of the dermatology spectrum. What am I doing for my skin, my volume loss, my skin laxity? Do I need a laser? Do I need a hair serum? I need someone who's an expert. I need someone who understands the basic science and knows what to do. And I'll tell you one thing I've really learned at this conference is there are GLP receptors everywhere. So you've got GLP receptors in your skin, in your hair. So if you're on a GLP, absolutely, it's doing great things for your health, but you've got to be aware of some potentially challenging effects on skin and hair. And so if you're doing a GLP, I think it's so important to use a serum like you have, an injectable as you need, but you really need an expert to guide you through that journey. And you've certainly done it. I think you look pretty great 10 years later.
I've been
talking to all of us.
It's funny. So I started at Eli Lilly, and the very first GLP-1 product was a brand called Baida.
I
actually worked on that.
Oh
and helped
my gosh,
launch
Drew.
it way
Full
back
circle.
in the day. And now it's become big in aesthetics. I've actually been taking some GLP-1s as well. I've had some great results as well. So obviously you have to go to medical experts. But the interesting thing with GLP-1s, particularly for aesthetics, is you do get some volume loss. So that's why you need good skincare for your face. And you do get some hair loss potentially and hair thinning. And that's where products like our scalp serum and others that people have are really important. If you want to think about it, it's not just weight loss, but it's about the holistic, health and wellness for you as a patient. And again, that's part of the reason is from an Obagi standpoint, where we're trying to brand everything together. It makes it easier for patients. Like you want to just know that there's someone you can go to be trusted. You want to go to a practitioner that you trust. You want to go to brands that you can trust with great science and medical support. So that's what we're trying to do, and those are the types of practitioners we're trying to work with.
Well, good. Well, congratulations on being the general manager. That's awesome, and bringing these great products to all of us.
I have a question. You've got you've got a really great practice. I've been there, and you guys have been booming down in New Orleans. Do you have any advice for me on how do you lead a crazy group of people? Because I've got a crazy group of people now at Obagi, and I'm always looking for good leadership tips. Well, not to put you on the spot.
No, I think you've got to model the behavior you expect. And so I've got a busy practice, as you know. I've got an awesome partner, and the two of us run a private practice in New Orleans. So it's just the two of us. We've got about 17 employees. And it's hard to be a business owner, and it's hard to manage people. And the two biggest things that I've learned are model the behavior you expect. I like to start on time. I like to be detail oriented. I like to dot every I and cross every T. If I expect my staff to, I have to do it. So, and then my second thing is be a grateful leader. And that's something that going through residency, straight to medical school, straight to private practice, where it kind of didn't matter if my chief resident, and we've all seen this on the TV shows, the chief resident could be grateful or not, I was still coming to work. And I have to remember that my staff might not come back tomorrow, so I try to be a grateful leader. I hope I am, staff, if you're watching.
That's funny. So that's a great one. So I have two things I'd add to that. So one, I tell my teams, they're always like, what's your values as a leader? I said, there's three things that I really want people to have. One, I want them to do really amazing work. Two, I want them to have fun while they're doing it. And three, I want them to learn something new as much as they can. So it's always like, do great, have fun, and learn something new. And so we kind of have built a team and a culture, I think, that exudes that. And then the other thing, actually, it's interesting about like show up on time and do your work. So my dad was the CEO of a big healthcare company for about 20 years. And the number one thing he would always tell his team is like, you have to plan your work, and then you work your plan.
Oh, I love
And so like, it's just so simple. And I always tell my team that, and I kind of get back to like when you're treating patients, I go back to when I was in your practice. You gave me a plan, and I just execute and set plan. And then you come back and you check in and make sure the plan still makes sense. But like this idea, you plan your work, you work your plan, you have some fun, you learn some new things, you show up on time. It's not that complicated, right? Treat people nice, be grateful, be appreciative. You can have a lot of fun while you're doing it, whether you're in a dermatology practice in New Orleans or with a skincare company like Obagi that's been around for 35 years, and we think our next 35 is going to be even better. So
I think it's we're in such a great space. It's such a great time. There's so much going on, and I think what we're doing is really to bring it all around. Is just like your mother said, we're going to make people feel better because they look better. They look better because they are better.
Well, and I also love there's always something new, right? Everyone wants what's new. At the end of the day, there are some tried and true and proven things that work. That even if there's great new stuff, should almost always be part of your plan. HA fillers are probably one of those things. Good skincare is probably one of those things. So no matter what the sexy newest thing is, it's probably good to wait to see if we got some good data. make sure they get proven, make sure the great providers like yourself and others know how to use them.
Yeah.
And trust going to those great practices. That's kind of how I think about it.
Trust is such a great word.
Yeah.
Well, great. Well, thanks for coming and spending some
So
time with me
wonderful
today.
to be here. I love being in Chicago. It's so great to see you. Appreciate you guys hearing me. Hopefully people heard something interesting.
Yeah. All right.
Thanks.
Thank you.
Thanks for tuning in to the True Skin Experts podcast. If you found today's episode helpful, be sure to subscribe and share with someone who might benefit. For more resources or to find an ASDS board-certified dermatologist near you, visit ASDS.net and follow at ASDS SkinMD on all social media platforms. Until next time, take care of your skin. It's with you for a lifetime.